So somebody wanted to know about enophthalmos in neuro-ophthalmology. And enophthalmos is the opposite of exophthalmos, which means the eye is bulging out. Another name for exophthalmos is proptosis. So the eye is bulging in exophthalmos and the eye is sunken in enophthalmos. And one of the ways we can look for enophthalmos is you can be looking at someone from below. So we have their chin up like this, and we look from below, and that's called a worm's eye view because you're looking from below. And the worm's eye view is really a great way of seeing the difference because in a straight on view, it's hard to see that someone's eye is sunken in, but in the worm's eye view, much easier to see the enophthalmos. And the reason it's important to know this is usually it's the bulgy eye, the exophthalmic eye that we're worried about, that something's behind there. Common things are orbital tumors, thyroid eye disease, orbital cellulitis, trauma, hematoma. But sometimes the eye is actually sunken in, and that's the bad eye. So when it's the sunken in eye, it can sunk in or it can sink in medially. So common things are like post-trauma, where you have a blowout fracture, or you have an orbital floor fracture. The eye will be enophthalmic in that setting. Sometimes you have sinus disease here, and the sinus disease can be silent. And because of chronic recurrent sinusitis, negative air pressure develops in that sinus and it gets smaller and smaller. And so the eye can sink down in that setting, and that can cause diplopia, enophthalmos, and ptosis. And then sometimes there's a tumor in the eye socket, and the tumor, as opposed to causing exophthalmos because of mass effect, it's a fibrotic tumor and it's pulling the eye in. And so the prototype for that is serous metastatic breast cancer, which is one of the few cancers that causes enophthalmos rather than exophthalmos. So when we're seeing enophthalmos, usually the eye is sunken in, silent sinus, a tumor, serous breast cancer. Sometimes patients who have had chronic ventriculoperitoneal shunting can get the fluid sucked out of their eye socket and they can become enophthalmic over time. But mostly it's exophthalmos that we're worried about, not enophthalmos, and you can see it better using a worm's eye view.